Hello, I'm Dr. Philip Blum of Patient-Centered Neurology. I hope you enjoy this patient education material and find it useful. One of the most common questions brought to the attention of neurologists is what causes migraine? It is important to realize that migraines aren't simply severe headaches. There are many disorders that cause severe headaches, but the most common by far is migraine. Certainly there are severe headache disorders that are not migraines, and to make things more confusing, migraines do not always cause severe headaches. Most people who suffer migraines have some severe and some not so severe headaches. I have that kind of headache problem with migraines. A few migraine sufferers have no headache at all. So the main point is that migraine disorders are associated with severe headaches, but aren't simply a pain disorder of the head. Migraines cause a widespread change in the function of the brain. This change is so dramatic and profound as to constitute a completely unique state of the brain. A brain in the migraine state is as different from the normal awake brain as is the sleeping brain from the normal awake brain. During a migraine, some functions of the brain become hyperactive. The sensitivity to sensory input becomes extreme. Normal light is perceived as blinding. Normal sound becomes piercing, and normal activity overwhelming. Even normal smells can be sensed by the brain in the migraine state as wildly powerful. Meanwhile, other functions of the brain in the migraine state become underactive. The ability to concentrate is depressed, and migraine sufferers may have trouble speaking or thinking clearly. In the case of migraine with aura, the ability to feel, see, or speak may not work correctly. This migraine sufferer is snowblind to the right side of the visual field with each eye. And of course, during a migraine, there is usually a headache. There may even be a severe headache, occurring on one or both sides. So what causes the state of the brain to change to this dramatically altered one? Genetics primarily. The vast majority of migraine is attributable to gene programming. Don't be confused between heredity and genetic makeup. Many people with migraine have parents or other relatives with migraine, and others are the first in their family with genes that cause migraine. Which genes cause or contribute to migraine has not yet been worked out. There appear to be many involved. The genetically susceptible brain is then capable of being triggered under certain environmental and other conditions to begin an attack of migraine, completely altering the normal state of the brain. Once a migraine attack begins, a wave of abnormal activity spreads across the brain, creating the increased or decreased function we discussed earlier. Once the migraine attack wave has begun, nerves are then triggered, fire abnormally, and become inflamed, causing additional symptoms. Nerve malfunction in the neck, scalp, and face can cause pain or tingling in those regions. In the sinuses, congestion can occur, imitating the symptoms of sinusitis. Further malfunction in the base of the brain then results in nausea. If you would like more detailed information about how migraines occur, click on this site and watch one of my favorite videos about the subject. And that's a brief description of how migraines occur and what causes them. I hope you found this presentation useful. I'm Dr. Philip Blum of Patient-Centered Neurology.